Uganda registered her first case of COVID-19 on 22nd March, a traveler who had recently returned from Dubai. Just before that, President Museveni addressed the nation, sending school children home and suspending public gatherings. This, coupled with reports that the outbreak had reached pandemic stage, caused fear as the reality of COVID-19 was now home.
In the interest of our people's health, this should be suspended for a month with immediate effect.
About a week later, a curfew was declared and Uganda closed her borders by declaring a curfew, closing all its borders and banning international passenger flights. Only cargo trucks and flights were allowed. President Museveni has since addressed the nation several times. Most of the COVID-19 infections were among truck drivers bringing goods in the country. More measures were announced, including the suspension of public transport and private car movement. 2 months later, some lockdown restrictions were lifted and life slowly began to return to normal. However, the easing came with new measures like wearing masks and observing social distancing. Public operators were required to register their vehicles and get route charts. Border riders have still been banned from carrying passengers. However, these measures are being ignored in many places, raising questions about whether the fear about the pandemic is as strong as it was in the beginning. It is also important to note that unlike many countries that have thousands of cases, Uganda has not registered a death from COVID-19.
It is a common human experience and very well documented. Hence, people tend to develop the COVID-19 alertness fatigue. Maintaining alertness is highly consuming in terms of emotional energy. And over time, you get fatigued and ultimately you drop out.
The consumption of unverified information across media platforms is another factor that propels the indifference towards COVID-19.
This social media rambling as well tends to be more contagious than the COVID-19 itself, has changed the attitude of people greatly.
Inadequate supply of food, especially to low-income earners, and the alleged mismanagement of COVID-19 funds has also raised concerns.
The borrowing in trillions from international donors has made ordinary Ugandans lose trust in government. Initially, they had started so well, everybody was cooperating. Now, loss of trust in leadership, and I can tell you, even when you issue guidelines, do not be surprised as a government when ordinary Ugandans just simply ignore.
According to Dr. Nyende, government should redesign its messages to capture the attention of the public.
Continue providing facts on the pandemic. We need to provide the statistics, accurate statistics. We need to redesign messages to capture attention of the population. We need to help build the trust between those who are managing the change process.
And therefore, you are going to increasingly see complacency. And even if people die, I can guarantee you are people not dying from malaria every day. Are people using mosquito nets religiously? Instead, there, in the fishing communities, they use them for fishing. Because hunger will kill them faster. You see what I mean? So people are willing to take risks to survive. And the leaders have abused the opportunity of trust.
Currently, Uganda has registered over 700 confirmed cases with 486 recoveries. Aaron Mukama, NTV Weekend Edition.